You may have heard about radio-frequency ablation in the past, and radio-frequency ablation is something that can be done for the axial skeleton, meaning the cervical thoracic or the lumbar spine, as well as the sacroiliac joints, and these have been done for years. A couple of new indications have come across in the last few years. One is doing the geniculate nerves of the knee, another is the hip nerves, which would be the obturator nerve and the femoral nerve. And then you also have now the ability to treat the shoulder by treating the lateral pectoral nerve, the axillary nerve, and the suprascapular nerve. So these are ways through a small procedure, I say procedure, like 10 or 15 minute procedure, that we can potentially get your patients somewhere in the neighborhood of a year to 2 years of relief. So what that has done is we take them to the operating room, we do a trial block with just local anesthetic, usually a small amount of Marcaine, like less than a half cc or so of that, and then we test to see if that affects their pain in a positive fashion, and if it does, we leave the trial and go on to the what we call the ablation. And the ablation is performed using a heated needle that heats up to a point where it will sever the nerves. In the lumbar spine, where it's working on are what we call the facet joints, and in the cervical spine, the same thing. But like I mentioned, with the knee, a lot of patients have osteoarthritis of the knee, or they have already had a total joint replacement in their knee or hip, or they're too old or too sick or too overweight, or you fill in the blank, they have too many medical problems to have a major surgery. These are all good candidates for radiofrequency ablation. So again, these are patients that maybe have already had surgery or haven't had surgery and don't want surgery. You have a lot of different latitude here into different patients that you could refer for these conditions and this treatment.